I'm Monica Goodwin, and I have been here at CRMC about 25 years, and I have been delivering obstetrical care for about 28 years. And in my practice, I care for infants all the way to teens, adults, and elderly, as well as expecting mothers. Natural childbirth is, in my experience, what every expecting mother would desire. However, that can be defined in a variety of ways. Some feel natural childbirth is delivering without any intervention, any analgesia, and others feel natural childbirth is delivering comfortably. So, again, knowing that this can be a broad spectrum, we at CRMC we like to know the desires of an expecting mother and try to work together with our experienced staff and meet the needs and try to achieve an experience of what is desired by the expecting mother. Sometimes this means offering some measures of comfort, and sometimes it means just stepping back and let the natural process begin. For the laboring patient that prefers a completely sort of hands-off natural process without analgesia, we have a lot of things we can offer. We have jacuzzi tubs in every delivery room. We have a water birth tub for those that desire to deliver in the tub, in the water bath. We have birthing balls, something we call a peanut ball that we place between the knees that opens up the pelvis and allows for a more natural descent of the baby. And, we always encourage ambulation and position changes and sometimes even aromatherapy, music. We sort of allow anything in the room that makes the mom feel more comfortable as she's going through this very natural process. I think every expectant mother has a lot of expectations, and delivery can bring on a lot of anticipation and sometimes anxiety. And I think having those discussions during the pregnancy helps ease some of that. And then again, working as a team with our nurses and staff in general to help bring about that experience that the woman desires, obviously with the ultimate goal of a healthy mom and a healthy baby. That's always my desire, and most of the time we are able to get close to that. So maybe the labor goes longer than expected and is a little more difficult than expected. Some people do want a little analgesia to make things more comfortable, and we have many options available. One is nitrous oxide, which is also known as laughing gas. That can often take the edge off to help women just get over that hump and get ready to deliver. It also doesn't sedate the baby at all. There's no real risk to the baby, and she delivers this herself through a mask. So that's simple. We also have IV medication, and of course epidurals are offered as well. And again, this sometimes is just what it takes to facilitate that birthing experience. And occasionally we do end up with a surgical delivery, and even with that process, we still strive to make it as natural as possible and allow the mom to be aware and present for that experience, and her support staff, husband or family member that might be with her, we also allow them to be present if possible, and available to be a part of that process, and then get baby to the breast immediately after delivery if that's her choice of feeding. When a woman discovers that she's pregnant, usually it's good to contact, the clinic and get in for at least that first checkup. The first checkup is with our nurse practitioner, Donna Claypool, and that's important for verification of the pregnancy and viability, as well as dating. Those first 2 to 3 months are critical to get in for dating, which is essential for management of the pregnancy. And Donna does a thorough job of getting all the groundwork done, and then she will send the patient off for an appointment with the provider of their choice. So by at least 8 or 9 weeks is a good time to get in and get dating and get that first visit to verify the pregnancy.